Well, good morning, everyone. We'll go ahead and get started. Thank you for joining us this morning on our second in our Synapse webinar series for our healthcare clients. I'm really excited to see all of you this morning. Thanks for joining us bright and early. My name is Sarah Dunaway, and I'm joined by my partner, Julia Ryland. And today we're going to talk about the new assisted living licensure that's going into effect in Minnesota, but with a focus on what other healthcare providers should know about these new rules. And those of you who live and work in assisted living may be a little overwhelmed and tired of hearing about the new assisted living rules, but for the rest of the healthcare community, we wanted to talk about what's happening and things that you might want to be aware of as these rules go into effect later this summer. So just a quick overview of our agenda. Julia is going to give sort of a orienting sort of market and industry overview. I'm going to talk about the current assisted living regulatory structure and how it's changing. And then we'll touch on things that you might hear from your business partners, way that it might affect you as a fellow healthcare provider, and also things that you might hear from patients or residents who live or receive services in an assisted living, and then happy to have some time for questions. We invite you to ask questions along the way by using the chat function, and then we will try to answer them at the end. If for some reason we don't have time to answer your questions or it's a more unique situation, we'll follow up with you after the webinar. And then just wanted to let everyone know that we are recording this webinar. It will be available on our website along with the slides on Monday. So with that, we'll get started.
Well, good morning, everybody. I'm just going to kick it off and talk a little bit about where we are in terms of the market and everything that's been happening in Minnesota here. I'm sure it's no surprise to anybody on this call that we have a really strong industry with a lot of really skilled providers here in Minnesota. It's just a testament to our good healthcare. And like other systems and other sectors of the industry, we've seen a lot of growth and a lot of movement historically. There's been very active in terms of collaboration and transactions and consolidations. And in part, this is due to the big growth we have in just the aging population. It's been a really attractive market, assisted living in particular, just due to the nature of everybody growing and sort of changing. The numbers are just very dramatic. If you look at some of the statistics, we have about 10,000, some numbers are predicting 10,000 baby boomers to reach 65 each day over the coming years, which is going to lead to about a 75% increase in terms of the heads of households by 2038, which is just really dramatic. So in terms of the shift in the needs of the population, we're seeing a really, really big increase. That just to put it in perspective, we're thinking about double numbers from what we saw in 2018 in terms of people who are going to be needing this kind of care. So that's creating a really attractive environment for providers coming into the market, a lot of things changing. We have a variety of different ways that this can happen through assisted living, independent living, memory care, skilled nursing. And we've seen a lot of growth, particularly when it comes to private equity and national players sort of entering the market. When you're thinking about physicians and hospital partners, there's just a really big range of ways that providers can collaborate between each other. We have, on the one end of the spectrum, you can do a lot of independent operations, which is really good relationships and helpful, systems between the two. But then you have on the other end of the spectrum, true collaborations through clinical integration or joint ventures. So there's a lot of options. We're seeing a lot of changes in terms of home health, and I'm going to talk about that just in a little bit. Particularly coming from the COVID pandemic, we're seeing a lot of increased focus on home health, maybe supplemented with telemedicine. And so some of those collaborations are springing up and having a strong foothold. Next slide, please, Sarah. So the COVID-19 pandemic has, of course, sort of changed the market over the last year. We've seen an uneven impact in terms of the sectors. There's been a decline in nursing home occupancy, but yet, as I mentioned, an increase in the demand for home health. In part, we have a big change in terms of the high-risk population with respect to COVID-19 and the nature of congregate living that's had a dramatic impact in just how this population is impacted. We've also seen just providers have a very, very high increase in expenses, both stemming from the need for PPE. There's been a big push to change policies and procedures, big administrative burden focusing on how to handle the pandemic and react to some of the things that are happening. It's also amplified the staffing shortages that we're seeing sort of across the industry. That's a big issue just industry-wide, but particularly when it comes to this long-term care focus, we have staffing who are just exposed to the virus, who have to go out. We have issues coming with staffing across segments. So that's been a big problem and a big challenge. In part, it's pushed a lot of providers to look for new partners, both in terms of financial support. They're needing additional help that they haven't had access before. They're also looking for other opportunities in terms of collaborations and partnerships. And it's also sort of created this weird environment where seasoned operators maybe have a new opportunity to sort of take over as sort of troubled assets that have become a little bit more difficult to manage because of the pandemic. Next slide, please. So despite all of these issues, we've still seen a lot of movement in terms of transactions. Q3, Q4 of 2020, surprisingly so, right in the heart of the pandemic, we did see, and this is on the national level, a large number of transactions happening. You'll notice that big focus was on assisted living, which is just sort of in Minnesota, the nature of how this is regulated and structured. And Sarah's going to talk about this a little bit more. It's a really, and historically has been in Minnesota, a ripe market for partnerships and sort of kind of traditional real estate entities to come in and manage the system. But as we're gonna mention, this is all being turned on its head and going to be changing dramatically. Next slide, please. So I'm going to turn it over. The complicating factor in our market now is really this new Minnesota Assisted Living Licensure Law, and it's going to change the providers that are in the area and in the industry. And Sarah's going to explain exactly how and why.
Well, I'm not sure I can explain why, but I will explain how. So one thing for those of you who are live and work in Minnesota, we have had a regulatory framework here that we are gotten used to. It's been around for 20 plus years. Really what's happening is our regulatory scheme is becoming more similar to how most states regulate assisted living. So on the one hand, it's a really big change here, but for players who work in other states, it actually might feel a little bit more logical. So in today's framework, the way assisted living is regulated in Minnesota is that there's, when you think of assisted living, really what is happening, what the resident is getting is, on the one hand, they're getting housing, and then they're also getting some supportive services. And that might be something as minimal as easy access to meals or congregate dining or assistance with laundry and housekeeping, all the way up to really intensive hands-on home care. Minnesota's current regulatory framework is that those are both regulated separately, and the housing is really just a registration. You just have to tell the Department of Health who owns this building and who is the landlord. It's governed by landlord-tenant law. And then separately, we have a services provider who is a comprehensive home care provider, and that's the regulatory framework. And it really governs the provision of services to people, that hands-on services to people. Those two might be operated by the same legal entity. They might be two separate entities, but within the same corporate family, or they might be completely unrelated. And I would say, in our environment, I think that has been particularly friendly to like real estate investment companies and real estate developers who want to really just be in the business of the real estate and engage a professional home care provider to provide the services component. We see a lot of that combination in the industry here. The other important piece is if this assisted living facility accepts elderly waiver, Minnesota healthcare program, so some of the other waivers that pay for low income seniors to receive healthcare services, it's that home care provider that is the enrolled participant in the Minnesota healthcare program and that receives that payment. And then the two have a whatever contractual arrangement around how those revenues are recognized in their sort of collaborative relationship. What's changing, and the law is going into effect on August 1st this year, is that instead of those two different sort of registration plus license, it's going to be a single license for the building. And there will be some kind of enhanced and increased regulation on both the housing and the services side. In addition to that whole framework just for the facility and its licensure, Minnesota also has now a new licensure requirement for the individual who runs the building, and they're going to be called the assisted living director. It's a new term of art under our statutory framework, and those people now also have to be licensed. We have a similar concept in Minnesota for nursing homes, where a nursing home administrator has a license and the licensure for assisted living directors is sort of parallel to that. So those individuals now are all going through licensure, and that also is effective August 1st, and it's required the assisted living facility that it have a licensed assisted living director as its leader. And then just underneath that sort of framework, there are some new rules. Many of them are based on the old home care rules. So a lot of the sort of day-to-day operational stuff is quite similar to what these facilities are operating under today, but there are some enhanced and specific additional requirements like access to a nurse 24 hours a day, as well as I would say relatively significant increased health and safety standards related to the building itself. Buildings always have had to comply with building codes and so forth, but there's new construction standards only would apply to new construction on or after August 1st. But it's I would say, higher level of building standards that will now apply to assisted living facilities. So thinking about how this might actually play out, I'm a visual person, so I always like having some pictures. I have kind of two scenarios and it impacts how it might affect both residents and collaborative partners with a long-term care provider. So under today's environment, you have housing, and it might be, I'm calling it Company A, and that is the landlord, and they have sometimes they call it a lease, and sometimes they call it a resident agreement with the resident. And then there's also somebody providing the services. Again, could be same or could be different, but in my example, it's a different company, calling it Company B, has its own tax ID number, its own HFID, it's the identification number that our Minnesota system assigns to a healthcare provider. That entity also has an agreement if the person is receiving any services, and not every resident in an assisted living facility receives services. You have a lot of people who live in an assisted living building who really think of themselves as just living in an apartment and they don't access services. But if they are accessing services, then they would have a services agreement with the home care provider in today's environment. So tomorrow, or not tomorrow, August 1st, that will be one entity that will have responsibility for both the housing and the services component. One of the things that's changing is that they will have to have what's now going to be called an assisted living contract. Some providers might call it a resident contract that covers both the housing and the services component. So right away, one of the things that all the residents are going to be experiencing is that they're going to get a new contract from their provider that they have to sign. And everybody needs to sign them. I mean, really, they should be signed by August 1st. And it's going to include all the, both the housing and the services, as well as some required statutory terms. Thinking about how this transition might actually play out, in one example, we have the current housing provider becoming the assisted living licensee. Because remember, under the current rules, you could have two different companies with those. So one of them is going to have to decide to hold this assisted living license. In that scenario, the assisted living, the HFID is going to be the same as the housing provider. And this is going to be true in my next scenario with a home care provider, because the way the Department of Health is doing this, that's always going to be attached to the building. Tax ID number would be the same. The reason that's all important is it's the same entity that then is signing this housing contract. So the landlord's not changing, but the service provider is changing. What that means then is that the service provider technically has to terminate its services. This is a home care provider. When they stop providing home care services, they have a mandatory notice to the recipient of services that those services are being terminated. It will be replaced by this new services agreement. But you can anticipate in a community of seniors who are dependent on these services, that there is the real potential that that's going to be confusing to people, that they're going to get this termination notice and be alarmed that something terrible is happening, when in fact it's just this administrative change and the name of the provider is changing. So just walking through it real quickly, Company A will enter into a new assisted living contract with every resident. Company B, in my example, has to terminate those services. Company A has some additional ownership disclosures to the Department of Health when it applies for assisted living licensure. That application requires disclosure of all the owners, direct and indirect owners, and they all have to disclose any criminal history and go through criminal background checks. Home care providers would be used to that because that's part of home care licensure, but it isn't currently part of the housing and services registration. And so that's something that could be new to that real estate developer, for example, that owns the building. The other change is that the housing provider in this example would not be the enrolled provider today in Minnesota healthcare programs. So if this building takes elderly waiver or any other waivered programs, when it moves to assisted living licensure, that provider is going to have to go through provider enrollment and enroll in those programs as a new provider. Should be effective August 1st, but there could be a delay in the processing of that, which would be an interruption in their cash flow. Moving to my second example, it's going to be similar, but I'll highlight a couple of differences. So again, same situation today, but instead of the housing provider becoming the license holder, the home care provider becomes the licensing holder. And I will say it's probably 50-50 in terms of what's happening in the field as to how this is playing out. In this example, so Company B now is going to be the provider of everything. So there's its tax ID number. The HFID, though, is still the same because that's attached to the building. Again, assisted living contract, same thing that we talked about before. But what this transition will mean is that it's this entity that's going to be listening. So the residents still have to go through signing a new assisted living contract. But what they're going to be getting then is a notice of termination from their former housing provider. Again, nothing is really changing except the name of the entity that is providing their housing. But if it's not orchestrated well, and then just understanding it's reasonable that people are going to get confused, it could feel alarming that they're being evicted when they're not, they're just being asked to sign a new contract. Clearly, communication is going to be really important for everybody in this context, but it's just confusing. And so I think we all are sort of bracing ourselves that even with the best communication, there will be some confusion. When it comes to the Minnesota healthcare programs enrollment, it's probably less of a risk of interruption of cash flow because in this example, the home care provider would already be the enrolled provider for elderly waiver under today's rules, and then they will continue to be enrolled after August 1st. That enrollment will have to be updated to evidence that they have received their assisted living license. And the Department of Human Services is going to have to change the enrollment because the ID number for that provider is going to be changing. So again, there will be some changes. It should all be retroactive to August 1st, but it is possible that there will be delays and that would result in an interruption in cash flow for them. So with that, just anticipating, I know I've touched on a little bit, we're going to talk about, a couple other changes, and then we'll talk about things that the rest of you should know. So just some things that we've seen that are changing that I think are important to be aware of. So one is just to be sympathetic to your colleagues and peers who are working in this field, because this is a really big change. So everybody, and remember, I mean, just as with all healthcare providers, this field was really impacted by COVID. And many of the people who are the frontline people on dealing with these licensure changes and the communications with residents and families are the same people who have been on the front lines and dealing with COVID challenges. And so everybody's been working at 150% under really challenging circumstances. And then now they're dealing with this. So I think a great deal of patience and kindness for all of our colleagues is one thing that important for understanding this context. Couple other things are that the vocabulary is changing in this field. And technically, under the regulatory framework, every resident is going to be considered an assisted living resident, even if they're not receiving any services. And in some communities, that might kind of be a big deal because many of those residents don't view themselves as assisted living residents. They really believe that they're independent. They live in their own apartment. but they're in a building where 20 years from now, when they age in place, they can access services. And so it's quite possible there will just be some sort of backlash just around that terminology and people taking offense that they're being called something that they don't view themselves as being. Other just vocabulary change, less likely to be controversial, but just important to be aware of, is that there now will be 2 categories of licensure. One is assisted living. That's just for sort of all the services, housing plus services that we've talked about. And then there's a second category, which is if the facility provides any specialized memory care services, they have to be licensed as assisted living with dementia care. And that attaches again to the entire building. So even if they have a separate dementia care unit within the building, like a floor, which is really common, the whole building is going to be assisted living with dementia care. And so again, that's an area where there might be some confusion among residents and families who are not receiving dementia care, that somehow something is changing, and it's just the vocabulary that's changing. As I mentioned before, some of the requirements on facilities are changing. So there's just some new rules around health and safety standards. Those are going to be most noticeable in new construction, less so for current buildings, but there are a few things in current buildings around fire safety and so forth that are changing. And then the other change will be that there's more Department of Health now survey. I mean, they currently do surveys for the home care providers, but now that survey will include the physical plant in ensuring that the building and the meal preparation and all the other aspects of the physical plant comply with the new rules. And so that's going to be a pretty big change for this field. I think they will look and feel a lot more like a nursing home survey than a home care survey that these providers have been used to dealing with for the last many years. The service requirements are really built on the home care rules. So many of those aspects are not really changing. They've just been imported over from the home care rules, but there are a few additional rules related to staffing, accessibility and minimum staffing requirements, training for staff, some heightened food standards. All providers have to offer 3 meals a day, for example, and some rules around how you charge for meals or don't charge for meals. And then one of the other big changes that is on the horizon as we start to really move into this new framework is that the statute includes significant new protections for residents if their services, if their contract is being terminated. So in today's world, it would be an eviction and a service termination. In tomorrow's world, it's just a termination of that resident contract, and the statute builds in a really high degree of consumer protections around that. The public policy behind that makes a lot of sense in that it's really helping protect vulnerable seniors. The practical effect of it will be that it will be very difficult for providers to deal with situations where people stop paying or become unable to pay. And it's going to be some real challenges for the field as we deal with those unfortunate but real situations. The other element that's changing is just much more clear role for the Ombudsman's office to be involved in those situations where a contract is needing to be terminated. This is more detail than all of you need, but I just wanted to sort of give you a picture of what's happening. This has been on the horizon for quite some time. Providers were really busy in April starting to prepare for the licensure. The Department of Health was has been doing rulemaking now for several months, but it really came to a peak in April. Those rules are not final, and they are not likely to be final by August 1st. So the providers are in this weird situation where they're going to be held to standards that actually have not been fully adopted. So it's just the reality of where we are right now, but that's one of the moving targets. The month of May for existing providers is really dominated by needing to submit their applications. The applications became available at the beginning of the month. They're due by the end of the month. And that's both for the assisted living, like the directors, as well as the facilities. So people are madly filling out their applications right now. In addition, those notices that I mentioned, some of those have a 60-day notice requirement, the home care providers, and so that 60 days before August 1st is May 31st. The deadline for current providers looking at June, the deadline, as I said, is June 1st. So all that stuff needs to be done before the beginning of the month. June 30th is the deadline for the directors who want to be grandfathered in. There's some good pathways for people who are already holding those positions to obtain that licensure, but that closes on June 30th. And some of the other notices that we talked about actually only have a 30-day, that deadline would be June 30th. The month of July, people will be waiting for their applications. There may be some background studies that need to happen. Providers will be getting their residents to sign off on those new resident contracts. They have a bunch of notices that they need to distribute. There's a universal checklist of services, a new bill of rights. They have to make sure all their policies and procedures are in place. They will be held to a compliance standard on August 1st. So they're all aiming towards that August 1st deadline. And then August is the real deal. So Julia.
Okay, so physician groups, health systems, hospitals, of course, you're not going to be as directly impacted as assisted living providers going through this whole process, but you should still be prepared for some sort of indirect changes to happen on your end to the extent you have collaborations and partnerships in place. So some of these are going to be small, as Sarah mentioned. Some may be as simple as just names changing, just actual technical amendments to some agreements, but some changes may be more significant. So we are seeing some movement in terms of who's actually going to be holding the license. You know, in some situations, it may be the home care provider, which is probably going to be the partner you're most used to working with. But in other changes, it's going to be the actual, you know, former landlord or the real estate investment entity that's actually going to be the one now applying and holding this assisted living license. So that may be impactful in terms of your contractual arrangements. It may change some of the things you have in your preferred provider agreements or other things that you have in place. Could be a big shift. You should also be prepared for there to be potential changes to some of the quality standards that you have in place, some of the health and safety things that are happening in this world. You may be thinking about wanting to build in some of those to the extent they're not already in place. Also, as Sarah mentioned, just be very forgiving because there's a lot of internal disruptions and challenges that these providers are facing. So they're going through the licensure process right now. They're preparing to notify residents. They're thinking about things like all the notices and the changes to the resident contracts. And so that's just inherently going to be a big challenge and a big burden. So if you have partnerships or collaborations in the works, don't be surprised if those slow down for the time being, because the focus may just be simply shifting to these other kind of fires and more urgent issues. There's also potential for some change in staffing, some employment home things. So just be aware that administratively and internally, there's going to be a big dramatic shift. Also prepare yourself for some sort of market changes. It could impact branding. So the name that you think of when you think of certain facilities may be changing. So it may be the same physical location, but there could be some naming, some branding changes that are happening. And it also could just impact the way that new entrants and new players are coming into the market. So it could be less likely that we're seeing some private equity investments and some new national players coming in, at least for a little while, until the drama of this new change gets under hold and the regulatory world settles down a little bit. So we may see a slow in that world. Sarah, I'll turn it back to you.
So then thinking about what else, how else it might impact other healthcare providers, and that is that you may share patients or residents with assisted living facilities. And I've hinted at some of these, but I can anticipate physicians and other primary care providers in particular getting questions or concerns from their patients who are residents, that when they get these notices, that there may be alarm about their services changing or their housing changes. And so I think being prepared that those questions might be coming. You're not their lawyer, but to be able to be reassuring that these are really behind the scenes changes that trigger some mandatory notices and requirements, but that at the end of the day, it's likely that it's the same people, the same terms, and everything else is the same. It's just new names and sort of dramatic notices. As I mentioned, I think that we might see some people being sort of offended at the change in the vocabulary, in particular being referred to as assisted living, or that they live in an assisted living with dementia care building when they don't access assisted living services or dementia care services. So again, just a thing to be aware of and be prepared for. Thinking longer term, this regulatory change for this field is increasing its costs. There's no question. The licensing fees are higher just to begin with. And the cost of compliance are going to be higher. There are more rules. There will be more surveys. In new construction, the construction standards are higher, and so those costs will go up. So I do expect that over time we will see, increased costs on this sector, and then the residents who are reliant on it. So that might be a concern that you hear about from residents and families. And then we are seeing some facilities effectively opting out of being assisted living, and instead of moving into this higher sort of regulatory scheme and being a licensed assisted living provider, they're moving back the other direction, which is to just be a housing provider and letting people arrange for their own home care. And that is an option, and it's definitely, I think, there will be a segment of this field who are going to move in that direction on August 1st. And what that will mean for residents could be that it could be for many of them fairly seamless, but it will be a less kind of holistic one-stop shop approach to their services, and it will be more that they will have to be kind of a la carte and have to arrange for home care. Could be from the current same provider they're getting today, but it won't be so clearly connected and sort of one-stop shop as what they're used to getting in the current environment. I think that covers all of our materials. So with that, Julie, did we get any questions in the chat?
The one question, Sarah, was just if there's been any talk about how this change will relate to the eviction moratorium that we have right now related to the pandemic. So any thoughts on that?
I think we're all thinking of it that the eviction moratorium, assuming it continues to be in place, will continue to apply to housing in this situation as well. We don't think it precludes this transition from occurring because people are not actually being evicted. They're just having a change in the form of contract due to this licensing. And so everyone that I'm aware of that's working in this field is assuming that it doesn't somehow preclude the current landlord from giving the required notices in connection with this transition if the person's housing is not actually changing. So
Great.
Great. Well, thank you so much, everyone, for all your attention. And if you have additional questions, please feel free to reach out to either one of us. And thanks for joining us this morning.
Take care. Good morning.